Hello friends. So with this new day and age of busy life, smartphones, Facebook, social media, we're ignoring one thing: childbearing, late childbearing. So the primary problem over here is late marriages, desire to have children later, or not wanting to have children and then planning it much later. So this whole thing falls under delayed fertility, or the word I don't like so much, infertility. Now what actually happens over here? Now, ideally speaking, many patients come to us, they want to have a child, they've been to a previous hospital or a gynecologist before, they get files, they are confused. So many blood tests, so many x-rays, sonographies. We've seen files over the course of 4 to even 10 years, patients carrying multiple files to assess them for infertility. So it's not that difficult as it's thought out to be. So what are the basic things when you assess a patient for infertility? Number one, the first thing is the history of the patient. What history? Her age, her husband's age, her menstrual history, any previous illnesses, any polyp with the thyroid gland, any breast or nipple discharge, anything to do with her medical or surgical history which is relevant to infertility, her ovaries and periods is thorough important. Then a thorough sexual history, her coital history, the technique of coitus, the timing of coitus, everything to do with the sexual function of the male and the female. For the male, essentially the semen analysis, which is the count of the sperms, which is the count, motility, the morphology is very important. The sperm has to be of good quality and a good number for natural intercourse to help in fertility. As for the females, if the periods are irregular, she has to do a serum LH and FSH, which is the follicle stimulating hormone and the luteinizing hormone if the periods are irregular. If the periods are regular, then the next thing is to do is the serum prolactin and the serum thyroid stimulating hormone, also called as TSH. These are the first line of investigations for every person trying to get pregnant. The second tier or the second level of investigations are the tubal testing. Now the fallopian tubes, if you look at the model of the uterus opens up into the two fallopian tubes. The patency of the tubes should be normal. There should be a proper anatomy of the egg going via the tubes into the uterine cavity and meeting the sperm. This is how pregnancy and conception occurs. So tubal testing is tested via the HSG, which is the X-ray method when the woman is conscious between the day 7 and 10 of the periods, or the histolaparoscopy, which is a more advanced test in which a patient under anesthesia is visualized for the internal of the uterine cavity, the opening of the tubes, or then externally, which is the uterus, the ovaries, and the relationship of the tubes and the ovaries together. So there are various levels of testing. Not every patient requires them all. A patient's thorough assessment, her history, and her sexual condition will let us know whether any tests are required or not. And this is something that requires a lot of patience. Patients do get impatient themselves. Patients do get a little bogged down. They feel let down. But you have to have that amount of power, determination not to give up. And the doctor who's treating you has to have that empathy and has to put himself in your shoes and treat you. That's all, folks. Any more questions, any more suggestions, please write to me. Please contact me. If you like the video, hit the like button, subscribe to our channel, and share it with your friends. Thank you. Have a very good day.